Well, the state is expanding the use of antibody treatments to cut down on hospitalizations and deaths.
Angeline McCall tells us state leaders are trying to make it more accessible.
This is yet another tool in the toolbox that we can use to keep people safe and move them safely out of the hospital.
Governor Whitmer encouraging Michiganders recently diagnosed with COVID-19 to see if they qualify for monoclonal antibody treatments, which essentially is lab-made molecules that mimic the immune system's ability to fight the virus, proving effective in reducing symptoms and risk of hospitalization.
I want you to know that we are doing everything we can to make this therapy available to everyone who qualifies for free as quickly as possible.
More than 70 sites in 37 Michigan counties are providing the treatments, designed to be administered through an IV within 10 days of symptom onset after testing positive.
It's one of these times where we're really underutilizing a therapy. We have this is a time in the pandemic, one of the first times in the pandemic where we really have a resource that is not in short supply that could easily be used.
Even if you don't have insurance, you can get it, with Governor Whitmer working with the federal government and healthcare providers to get administrative costs waived.
I will not stop fighting for more tests, more vaccines, more ways to keep you and your family safe.
Angeline McCall, Fox 17 News.
Well, many people may have never heard of this antibody therapy for fighting the rising number of COVID cases.
So joining us with a closer look at what the treatment is and how it works is infectious disease specialist Dr. Gordana from Spectrum Health. Thanks so much for joining us this morning.
Good morning.
All right, doctor, let's talk about this antibody therapy. How long has it been in the process, or, has it been around, and why haven't we heard about it before?
This treatment has been available since December last year, and in Spectrum Health we have special clinic just for monoclonal antibody use. We already treated 600 patients in this clinic. Monoclonal antibodies are used under emergent use authorization, and we are trying to make that available to as many patients as possible.
And talk a little bit, explain, to the average person, how it works in the fight against COVID-19.
So when a virus enters human body, our immune system makes proteins that bind and kill virus. These proteins are called antibodies. Now, for our immune system, it takes some time to make enough antibodies. Monoclonal antibodies, this therapy, are the same type of proteins, just artificial, made in the lab. When we give this therapy to the patient infected with COVID, this therapy does exactly the same job. It binds and kills virus. So that way, monoclonal antibodies slow disease progression. They reduce symptoms and risk for developing severe disease and risk for hospitalizations and death. This therapy also gives enough time to our immune system to make its own antibodies for long-term protection.
So, doctor, can this actually replace a vaccine?
Actually, this is completely different from vaccine. Vaccine is given to the healthy people to make antibody in advance, so when they get in touch with virus, they have already made antibodies. Monoclonal antibodies are given to patients who are currently sick. They are sick, they don't have antibodies, and we are giving them artificial antibodies to help them fight infection.
So just another tool, really, in the fight against COVID. We appreciate your time this morning. Thank you so much.
You're welcome. Have a great day.
You too. All right. More than 7,900 new COVID cases have been reported across our state.
Alyssa Heron joining us in studio with an in-depth look at what percentage of our state is vaccinated and the number of new cases in West Michigan.
Hey, good morning. Well, that now brings the total to more than 764,000, as you can see right here. And if we take a look, there are also 33 new deaths that were reported within the past 24 hours. Now, to date, more than 16,000 Michiganders have died from COVID, and more than 587,000 have since recovered. If we take a look at the state's positivity rate, that continues to stand at 15.6%, which is far above the 3% threshold health officials wanted it at. And when it comes to vaccines, more than 5.5 million of them have been administered here in Michigan. That means nearly 43% of Michiganders have received their first dose. More than 28% of people across our state are fully vaccinated. And hospitalization rates in West Michigan, there are nearly 600 people hospitalized with a confirmed case of the virus. Right now, nearly 70 people are hospitalized on a ventilator. More than 130 patients remain in the ICU. If we take a closer look right here in West Michigan, we can see that there are 6 new deaths within the past 24 hours, but there have been 11,226 people now fully vaccinated. If we head on over to Ottawa County, within the past 24 hours, 942 people have both of their shots now fully vaccinated. And over here in Kent County, 2,462 people fully vaccinated. Of course, you can check out this map for yourself and check out different counties by visiting our mobile news app. Mike, Deanna.
And when it comes to vaccines, the CDC held an emergency meeting to discuss the Johnson & Johnson vaccine, which has been put on hold after reports of 6 women getting blood clots, one of whom died. That's of the nearly 7 million inoculations in the U.S. Health officials say they need more evidence to decide if the blood clot cases were indeed linked to the shot, and if so, how big the potential risk is during the effort to stem the pandemic. So for now, the pause on the Johnson & Johnson shot will remain in effect.
A heads up to those in Calhoun County who are still looking to be vaccinated.
The health department's walk-in vaccine clinic continues today at the YMCA in Battle Creek. It runs from 9 a.m. to 2:30 p.m. today and 8:30 to 11:30 tomorrow morning. And due to the pause on the Johnson & Johnson vaccine, the health department will be using the 2-dose Pfizer vaccine. We have these details posted for you on our website and our news app.
All right, it is 8:10 and still ahead this morning.